Is it a common procedure to mix Radiesse with saline to fill small lines and wrinkles? My doctor mixed saline with Radiesse and injected the solution into the smile lines on my face, including some lines in the middle of my cheek that used to be dimples. I looked up the procedure she performed on the internet, but haven't found anyone that is doing it. Is it a standard procedure? She said that by mixing saline with Radiesse, it acted like Sculptra. It wouldn't create volume, but it would make the wrinkles disappear.
Thank you for your question. You're asking if it's common practice to mix Radiesse with saline to use as a filler for smile lines and wrinkles. And you describe in your question a situation where your doctor is suggesting to you to use a diluted form of Radiesse in a way to act like Sculptra does to help you with areas in the cheeks where there was once a dimple. Well, I can understand your hesitation once you've done some research and you're not coming across this as, quote, common practice. But I can share with you a little bit as someone who is very experienced with fillers and has been someone who has tried different innovations with fillers and other materials to help people improve their appearance. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and I've been using injectable fillers since the days of Zyderm, Zyplast, the original collagen, and I routinely use the whole spectrum of fillers in my practice, from Restylane, Juvederm, Voluma, basically hyaluronic acid fillers, as well as Radiesse and Sculptra. So certainly I would say that I understand your doctor's thinking with the idea of using Radiesse in a way that you use Sculptra. Sculptra is a suspension of a material called polyl-lactic acid, and its behavior, or the way it responds in the body responds to it, is based on a certain amount of collagen response by placing this material more diffusely in an area like the cheek. Now, Radiesse is a suspension of calcium hydroxyapatite, which is very fine particles, and when it is placed, it is actually fairly robust in its ability to be a filler, but the idea of making it into a suspension certainly has a potential value. I think what you have to understand is that physicians are often, especially those who are creative and innovative, will often look at the palette of options and be creative with those options to try to give the patients the best results possible. Otherwise, everyone would be essentially a factory worker and just doing things a certain prescribed repetitive way. And although there is certain protocol and standards that should always be adhered to when approaching problems, innovation intrinsically requires some change in the way something is done to get a better result. For example, when it comes to fillers, we use hyaluronic acid fillers at a level that is between the bone and the muscle. That's very, very deep. Hyaluronic acid fillers are generally used for dermal filling. So that means that essentially you're putting a material that's normally placed at the skin level in an area that's much deeper. Now that can certainly raise question, but we've established the safety, the predictability, and the quality of the results, and the unique benefit. When I place hyaluronic acid at the bone structural level, it creates this angularity and this fullness that is absolutely remarkable and incomparable to standard methods of using fillers. So if your doctor is being innovative and creative, just because everybody else isn't doing the same thing, doesn't make it suspect. Talk to your doctor about whether or not she feels that it's likely that something like this will work out favorably. Has she done this for other patients, and how have their outcomes become? I think when it comes to being creative, innovative, full disclosure and being honest and straight with the patient is absolutely critical. Patient understands you're doing something that is a little bit outside of the box or way outside of the box. At least you're both walking in, you and the doctor are walking in with eyes wide open, and you understand that the results may not be as predictable as something else, that you're choosing this procedure over. So I think that it is important that you have a relationship of trust with your doctor. If you feel that you can't trust your doctor, or if you don't have confidence, then just don't do the procedure. But don't assume that everybody else who's doing the same thing, who might disparage this type of practice, to be right. If your doctor is conscientious about quality, safety, and being honest about expected results and what to do with different scenarios, then you should consider this option and see if this works out favorably for you. So I hope that was helpful. I wish you the best of luck, and thank you for your question.